you have that thing on the screen, the insurance companies? Okay. Mr. White, this is a chart that I wish I would have used in our last hearing, but this is one right now. I mean, this pretty well confirms what you're talking about. The stock price increase since from March 2010 through November 2025 of the 7 largest health companies pretty well proves your point. You want to comment on this?
Yes, sir. I think if you start looking at the numbers, what's happening here, again, the government created a very expensive product and then said to people like Christopher, well, we'll help you subsidize it. We'll give you a subsidy and we'll pay the insurance company for your access to that plan. And that subsidy increases dollar for dollar when the premium goes up. So the incentive is to increase the premium to get more subsidies. And that's what happened. So when you look at the gross margin per ACA enrollee, I think it's about $1,800 this year. That increased from $60 in 2014. It went straight through the roof as the subsidies increased. And that gets reflected in the stock price. Some of those stock prices are up by 1,500, 1,600, 1,800, 2,000%.
Investors are pretty smart. They're not going to drive up the stock price if their earnings potential isn't growing because of Obamacare. Can you think in the current system? Can you think of any incentive throughout healthcare to actually drive costs down? Can you think, I mean, again, of the players in there, the insurance companies, quite honestly, there should be incentive for government, but as you can see, they just want to throw, a few $100 billion more at a failed system. Is there any incentive?
The insurers are colluding with the hospitals and the other healthcare providers to drive costs up across the board. They make more money when the costs are higher because you've linked subsidies directly to the premiums. So everyone has an interest in colluding to get the costs as high as possible.
Everybody's getting a cut, and you're better off getting a cut of something, again, like a house. You'd rather sell $1 million house than a $100,000 house.
Yeah, correct? It's like getting a commission on $1 million house.
I was on CNBC yesterday morning, and right before me they had the now retiring CEO of Walmart. And it was a perfect segue into me, because I'm saying the solution here is consumerism. Mr. Jacobs, I mean, you are competing in the marketplace, right? If you could be a monopoly, and if you're a business person, you'd love to be a monopoly, you could have charge a lot higher prices. Your customer service wouldn't have to be that good. Your food wouldn't have to taste that good. But because of competition, you have to be really good. You can't afford to charge more than what customers will pay. And these customers are looking at all kinds of different restaurants. Your quality has to be good. People won't show up. And you better have some pretty pleasant waiters and waitresses too. So, okay, that's what a free market system does. That's what we've driven out of healthcare. You've got 10 cents of every dollar spent on healthcare being paid by a patient. The rest is through a third-party payer, either insurance carrier or the government. That's basically it, right? So I hear colleagues say we've got to pass a law for price transparency, and they have. It hasn't worked because, okay, you see it on the board, you don't care, because you're going in there and your insurance coverage is going to cover that MRI, and quite honestly, you'd rather have that MRI cost a lot, so you burn through your deductible, so you get into your actual insurance sometimes. So again, there's no incentive to lower costs, and I don't think you can drive competition through a government law. I think the only way to do it is bring consumerism back. And that's why I'll defend the baby step that the Republican alternative will be tomorrow. Again, I would like to have something far more robust, but it's at least moving that direction of bringing consumerism back in. I mean, Mr. Bragdon, would you kind of agree that consumerism is really what we need here?
I think if you don't have consumerism, then nobody has to be responsive to the patient. Right now, healthcare under Obamacare is between the insurance company and the federal government, and the patient's left off to the side. If your denial rate's 35%, like it is with United Healthcare, it doesn't matter because government's still going to shovel money into your big business. If you only have one choice for that specialist you need in network, too bad. You can't go anywhere else. And so if you don't have consumerism, you're left out in the cold, and that's what's happening to millions of
So
Americans.
again, I really wanted you to talk about, because I don't think we, in our last hearing or in this debate, talked about it enough, the 9-to-1 match. And in particular, talk about how that has driven scams, things like provider taxes, provider fees. It's not health care. It's driving up what the federal government has to spend, but it's also doing something pretty nasty about incentivizing providers to focus more on those able-bodied adults at the expense of a severely autistic child. But to talk about that, first of all, but then also just talk about, because of that, how hospitals, how states have literally structured their budgets around that, which is why we couldn't really fix that in the one big beautiful bill. I mean, there was just too many constituencies, too many states, Republican states, they were hammering on their Republican senators, going, hey, we need that 9-to-1 9-to-1 match. We need those scam dollars flowing out of the federal government.
So I think a great example of this is in Arkansas, using the story of Mr. Staley's son. So in Arkansas, the state share for kids with disabilities is the state has to put up about 30 cents, and then the federal government will match 70 cents. But for able-bodied expansion adults, the state puts up 10 cents, and the federal government matches it 9 cents. So Mr. Staley's son is on a waiting list. 90 cents, sorry. 90 cents. So Mr. Staley's son is on a waiting list for 11 years, but it costs the same total cost to the taxpayer for 2 able-bodied adults as 1 severely disabled child. So that 1 severely disabled child waits 11 years, but the same taxpayer costs, the 2 able-bodied adults go to the front of the line every time. It's incredibly perverse.
Isn't part of the problem, too, is particularly the Biden administration allowed those providers to charge commercial rates for Medicaid patients. So we're paying, what, double and triple sometime versus even Medicare rates? I mean, just talk about that dynamic.
Absolutely. Under the scheme called state-directed payments, you could have politically favored providers that got permission from the state and federal government to charge exorbitant rates, far above commercial rates, far above Medicare rates. And so what that effectively said was to that provider is it's better for you to treat a Medicaid patient than it is to treat an elderly person on Medicare, or sometimes than even to treat somebody with commercial insurance. So again, the federal government's picking winners and losers, but Medicaid expansion under Obamacare has made everyone else a loser, including the truly needy.
So, Mr. Staley, when did you first really discover this perverse incentive? I'd imagine you kind of signed up for home health care and you just probably were somewhat, why can't we get on it? I mean, when did this kind of dawn on you, what Medicaid expansion was doing and how it impacted your son and your family?
Sure. Yeah, so when we first expanded Medicaid in Arkansas, I called my state senator and I said, I want to know that when you guys do this, you're not going to do anything to harm these truly needy populations. And at the time, I didn't know anything about it. I'd never worked on healthcare policy. And so all I wanted to know about was the TEFRA waiver program, which is just basic Medicaid services. And my state senator said, don't worry, we got that covered. You're going to be fine. Well, that part was fine. But what I didn't know at the time, and what I didn't really know until some number of years shortly before we applied for waiver, was that the waiting list had grown, and that there were folks who had been on it as long as 13 years in our state. And in fact, there was one case of a young woman named Skylar who had a traumatic brain injury that resulted in neurological damage, and she spent almost her entire life on that waiting list, very nearly died on it, passed away when she was 18 years old, sadly. But we see this time and time again where people are literally dying on those waiting lists.
Are the single adults on the waiting list?
They
or
are
they
not.
get put in the front of the line?
They go to the front of the line.
So able-bodied adults go to the front of the line as disabled children wait, languish without those services for a decade or more.
That's accurate.
So, Ms. Briggs, I want to delve a little bit more in terms of what you had. When was your daughter diagnosed with leukemia?
November of 2015.
Of when?
2015.
2015. So this was already, Obamacare's in place. What kind of insurance did you have before Obamacare?
Yeah, so when I jumped out of my corporate job and decided to set up my consulting firm, we did a lot of searching in the pre-ACA marketplace to make sure that I could afford to take care of my family as I did this. And what we found was a tremendous number of plans available. So many, in fact, I had to bring in consultants to tell me what would be best for my family. And we settled on a plan that charged us maybe $800 a month in premiums. And the maximum out-of-pocket deductible was maybe $3,500 for the family. And that, as I said in my testimony, that just, I remember when this law was passed, and I turned to my wife and I said, they're going to socialize the insurance products market. This thing is going to explode. Like, there's no way we're going to keep our doctor. It's no way it's going to send it. And, within a matter of weeks in 2014, when it went into effect.
By the way, do you remember what were you paying for that? You said $800
Yeah, $800 and then about $3,500 on the back end. And then with Obamacare, it went to almost $2,000 right away. This is before cancer.
per month.
And the back end was about $17,000. I mean, it was really high. Fortunately, we didn't have that because we didn't have cancer in the house. When the cancer hit my daughter, things just went totally crazy. And then, as I said,
And again,
twice.
Prior to that, you didn't have a real narrow network. You had,
Oh, yeah, no. So in fact, we were able to we had, our other children who needed to go to Johns Hopkins, we went to Mayo Clinic. We could go almost anywhere.
so
And afterwards, no way. We couldn't go anywhere.
again, over my 30 years, you started getting in-network, out-of-network. I mean, again, the thing was definitely evolving. I'm not saying that the whole thing was perfect, but you could always go out-of-network. Now, you had a higher deductible or higher out-of-pocket maximum, but you could go. Did you have that option with Obamacare?
Absolutely not. No. Well,
You couldn't even go outside a network and pay more. You were just denied using that.
right. So Johns Hopkins said no. And we thought, well, maybe we'll go to CHOP, Children's Hospital in Philadelphia. And they said no. We even tried at one point because we knew we were going to get less care than we wanted. We thought, well, let's move to Texas. No state income tax, and MD Anderson is there, and Texas Children's Hospital. Maybe we can do that. And what we found out is that there wasn't a single Obamacare plan to buy that covered pediatric cancer care at MD Anderson or Texas Children's Hospital. And that is the same way, that is pretty much to this day. Yeah.
And I think it was Mr. Bragdon, you talked about that Obamacare is famous for, squeezing out or not allowing cancer centers into networks, which I actually find pretty shocking. I didn't realize that.
No, absolutely. And so when you think about providing access to people who need it most, like his daughter, you have the best quality providers shut out of network. In my written testimony, I cite an example where 97% of local doctors are out of network in some Chicago Obamacare plans.
It's not covered. Senator Slotkin.
Thank you, and thanks to our witnesses. Hopefully, if I'm here,